Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today I'll be speaking about what is Crohn's disease. But before we continue, make sure to subscribe down below for more and more videos. So let's start now. So let's start with the definition. Crohn's disease is a type of inflammatory bowel disease that causes swelling and irritation of the tissues called inflammation in the digestive tract. So inflammation anywhere along the digestive or the gastrointestinal tract suggests you have Crohn's disease. Now, what are the symptoms of Crohn's disease? Or in other words, how do you know you have Crohn's disease? If you have these three symptoms present, means you definitely have Crohn's, which are an ongoing diarrhea. Number two is belly pain or abdominal pain. And lastly, unexplained weight loss. If you have these three symptoms present, meaning that you definitely have Crohn's disease. Now you might ask me, what is the difference between Crohn's disease and ulcerative colitis? Crohn's disease can cause inflammation anywhere along the gastrointestinal or the digestive tract, starting from the mouth to the anus. So the mouth, pharynx, esophagus, stomach, small intestine, large intestine. Inflammation along these organs suggests that you have a Crohn's disease. Unlike ulcerative colitis, it causes inflammation and ulceration in the large intestine, that is the colon and rectum. So inflammation only in the large intestine, including the colon, and you know that colon is divided into ascending colon, descending colon, transverse colon, plus the anus or the rectum. Inflammation along these suggests that you have ulcerative colitis. As you can see in the top picture, inflammation along the large intestine, which is the colon, the ascending, descending, and transverse colon, plus the rectum, suggests that you have ulcerative colitis. Whereas in the down picture, you can see that the Crohn's disease can involve any part of the large intestine. Even the small intestine can be affected under the Crohn's disease. A clearer picture explaining you the difference between Crohn's disease and ulcerative colitis. You can see the Crohn's disease, the red part, meaning that inflammation can occur anywhere along the digestive or the gastrointestinal tract. Not like in the case of ulcerative colitis, only the large intestine plus the rectum is involved. Now, can people live with Crohn's disease? Yes, for sure they can, and we need to provide the treatment for such patients. Now, the first line of treatment, since there is an inflammation, so we give anti-inflammatory drugs, that is the corticosteroids, such as prednisone, can help reduce inflammation in the body. Next one is because it is an autoimmune reaction, so we need to give the patient immunosuppressants such as azathioprine. Number three is antibiotics need to be given. Why? Because there is a fistula. Fistula is an indication for an antibiotic. Fistula will form anywhere along the digestive tract because of the Crohn's disease. Lastly, because the patient will have an ongoing diarrhea, so for sure we need to prescribe for the patient antidiarrheal medications, such as psyllium husk, which is a fiber supplement, or methyl cellulose, can help relieve mild to moderate diarrhea by adding bulk to stool as well.